All right, y'all, welcome to Top 5, where we're going to be talking about some of the top 5 public health news going on this week. And we're going to begin with this story about a scientist having found a 48,000-year-old zombie virus that was founded in Russia. Thanks to, climate change and the warming temperatures and all that, due to oil, fossil fuels, not listening to basic science, the permafrost in Russia is starting to thaw out. What we are concerned with right now is that this might release viruses, that was thought to be extinct like 48,000 years ago back into the world. Viruses have been found, including the Pandora virus found at the bottom of Lake Yukechi. I'm sorry if I butchered that, in Russia. And basically they were found either in the mammoth's fur or in the intestines of Siberian wolves. The concerning part about this is that these viruses still have the ability to be infectious, and scientists have dubbed them health threats because of this. And as the rest of this article states, it's very concerning when you have diseases, even small little itty microscopic diseases that are still preserved in ice for millions and billions of years, because at the end of the day, it can just take one wrong move for us to mess up and basically get these like diseases back into circulation. So when people talk about climate change, it doesn't mean just like flooding is going to happen in, the coast, or hurricanes and stuff is going to happen, across the US or across the world or whatever. We're not going to have 2012. What we're talking about also is just like the threat that diseases that we thought were once extinct are coming back to infect us. It's ever more the reason why we need to be more cautious with climate change, and why climate change is so important for us to really just talk about, have a conversation about. All right, another controversy going on this week is Liver King. Basically, he admitted to steroids. I could have told you that a year ago when I saw him. So if you don't know who Brian Johnson is, basically he's a self-described, masculinity influencer, trying to build up the youth, trying to build up men, trying to promote this lifestyle of natural eating and exercise. His claim to fame, while also selling, diet, pills, supplements, all that, from his own personal brand, he was known for doing extreme exercises, living a caveman, off the ranch lifestyle, and basically devouring, natural raw diet of animal livers, hence the name Liver King, as well as hearts, testicles, and basically animal organs in general. And from even just a public health standpoint, I would never tell y'all to do that, because at the end of the day, there was a reason why pasteurization and heating and cooking your food became a thing. Scientists have studied raw meat for many, many years, and this is why we have such strict standards in restaurants and catering services to keep your meat at a certain temperature, or cook your meat at a certain temperature, in order to avoid illnesses like this. And basically, he turned it into a whole lifestyle, saying like, I'm all natural and all that. But come to find out, he's been using injections like steroids and a concoction of steroids for the past, few years, probably, to the tune of $11,000 per month. And obviously the health and fitness community was up in arms about all this, and it got to a point where he even released an apology video.
Yes, I've done steroids.
We know.
And yes,
We know.
I'm on steroids, monitored and managed by a trained hormone clinician. Liver King, the public figure, was an experiment to spread the message, to bring awareness to the 4,000 people a day who kill themselves.
Yeah, nah, we ain't doing that. All right, so against better judgment, I watched the rest of the video, and basically it's just him saying like, oh, I did this, because I want to raise awareness to all the, people going through mental health crisis, the people who are self-deleting, the people who are going through struggling. I did this to be a mentor, like trying to like get some sympathy. You still lie to your audience. You try to promote this natural as well as unsafe lifestyle, selling your supplements, gaining money off of this to your audience, from your audience. And at the end of the day, you're saying like, oh, I didn't like mean to like dissuade anybody. Oh, I was just trying to like help some people out. No, like you can't do that, because at the end of the day, you get somebody deleted. Because if you have an autoimmune disease and you ate raw meat and follow what this guy is doing, you could have deleted yourself like that. So yeah, that's just, I don't buy anything he's saying. He need to get canceled like every other millionaire and all that, like try to trick you. Now the next thing we're going to talk about is that Biden Congress was able to avert a railroad strike that was about to happen next week, but as you can tell by the title, some people are not happy about it. Basically, we haven't been keeping in the know. Railroad unions as well as railroad bosses, CEOs have been in, constant arguments, negotiations for the past few years in order to get a new tentative deal, to get better pay, to get healthcare premiums, as well as additional days, paid sick leave. And while a deal was struck back in September, where 8 of the unions basically voted to, like, you know, have this tentative agreement, basically 4 unions rejected this deal because it didn't have any sick days, you know, off. Now, when you look at the numbers, these 4 unions cover about half of the 115,000, you know, railroad workers who will be covered by the deal. And because of this, they were threatening to strike next week on the 9th. And basically, if you don't know how big of a deal this is, it would have crippled the entire U.S. economy. Like, they were going to be losing $10 billion a day. Not only just you couldn't get, you know, freight that was coming in from China, from our partners going across America, but basically it would have affected farmers. It would have affected transit, you know, public transportation passengers. It would have affected manufacturers in the U.S. It would have been a big deal. And this is why Congress and Biden needed to act, you know, quick enough to be able to avert this crisis. And when it came down to it, the House basically approved the tentative deal as well as another measure to be able to have 7 paid sick days. But when all that was sent to the Senate didn't approve the sick days. Basically, they didn't get the 60, you know, majority vote or super majority vote in the Senate. And basically, they were only able to pass the tentative deal without the sick days. That is what was sent to Biden, you know, on Friday to pass into law and to avert this crisis. A lot of people are praising Biden and the administration, Congress, and all that for passing this legislation. This was the fastest piece of legislation that was, like, sent through, you know, with the quickness, you know, when we talk about the economy. Let's not talk about gun control and all that. But basically, I'm very disappointed because paid sick days, especially in the context of COVID-19, are important. Like, imagine your coworker comes to work coughing up a storm, you know, and basically all they could do is just wear a mask, wear PPE. But because they can't have the ability, you know, to take a sick day off, they're living paycheck to paycheck, you could spread that disease to your coworker, to your family, basically affect the entire workforce theoretically. In my opinion, I feel like they had the right to have a sick day. They need to have more than 7 sick days, honestly. And I think with the tentative deal, they only get 1 paid sick day. And the fact of the matter is, the US, we're the only country in the world, or at least in the developed like West, that doesn't guarantee sick days under law. And that is just astounding to me. And I don't agree with the people in the US saying like, oh, they're being selfish. They could have like caused the whole economy to collapse. They could have caused a recession to come early, you know, just because they want to get some paid sick days. I don't think they're selfish, because at the end of the day, that should be guaranteed under law. All right, next story, we're going to talk about Balenciaga. They basically dropped a $25 million suit they had against the producers of a controversial campaign they were a part of. Basically, there was one with, you know, Supreme Court documents alluding towards, you know, the United States, you know, decision in 2008 about child pornography, as well as another campaign that actually featured child actors posing with NSFW teddy bears. I'm trying to be careful how I phrase it because I'm not trying to get canceled by YouTube. But basically, they were posing with teddy bears that had, you know, explicit gear on, basically, and trying to cater to an adult audience. Basically, they're suing the production company North 6 as well as the set designer Nicholas Jordans for their inclusion of a Supreme Court ruling that centered child pornography and whether it was protected under the, you know, First Amendment rights. United States versus Williams back in 2008 is a decision that was, you know, in the photo shoot. It was a decision by the Supreme Court of the United States that a federal statute prohibiting pandering of child pornography, offering or requesting the transfer, sale, deliver, or trade the items did not violate the First Amendment right of the United States Constitution because it is a crime. It is against the law. Going through the list after I read it all, basically it says you're not going to be going to jail because you offered to receive virtual material. But if you try to lead on, have the intent to lead on, or to tell the listener or whoever you're trying to, you know, do business with that this is actual children in the material, then that is in violation of the law. And as posted by the CEO and president of Balenciaga, they have made several actions. Basically, they're not just dropping in a litigation lawsuit, but basically they're going to have more internal, external, you know, evaluations of content going forward, as well as they're going to reorganize their image department to ensure full alignment with corporate guidelines and, you know, rules, which I don't understand why it wasn't there in the first place. Like, just forgetting this whole post to begin with, like just beginning, you know, that they didn't have the external, you know, internal evaluations, they didn't know any better. how could you send it to marketing? How could you send it to producers? How could that other external company and set designer, how could all these mechanisms, all these people see this and thought this was okay? Like, you're having a child pose with a NSFW teddy bear that has, you know, gear on. Like, how could you think that this was okay and trying to push this to adults? And the fact that this lawsuit wasn't even about the photos or images, but it was about having the image of the Supreme Court case, the document in the photo shoot, it really astounds me. And I feel like the DOJ, you know, federal like government need to get involved with this and actually do something about it. Like, it's very sickening, it's very disappointing. And you know, you have you know, Kim Kardashian, she's taking several days to release a statement. You got all these celebrities taking a few days to release a statement because they're making money off of Balenciaga, obviously. That it's just like, this is why I would never be a part of Hollywood. All right, so last topic of the day. This is like a story that was broken like last week, but basically we have entered a tridemic in the U.S. Now, if you don't know what that means, it's basically the spread of flu, RSV, and COVID have been dramatically rising in the past few weeks, especially with flu and RSV hitting historical numbers this fall. We are going to see a very, very long and stressful winter, especially for our healthcare systems, as they're continuing to be overwhelmed and understaffed.
Seniors are also being hospitalized at a higher rate.
Golly.
And hospitalizations from the flu are at a decade level high.
So like I said, we are at like some historic numbers with flu and RSV, especially when you talk about seniors and children being the most vulnerable, as well as immunocompromised individuals outside of that. So it's just one of those things where it's just like, be mindful who you be around this year.
So as we head into this Thanksgiving holiday, the first and most important thing is to make sure that your older relatives or you yourself have gotten that bivalent booster and have gotten your flu shot.
All right, so I'm not gonna bore you with the rest of the video, but if you've been to the channel since I've started, you've known I've always been an advocate for the vaccine and whatever the booster, whether the flu shot, whether, you know, if they get this RSV shot, which they actually approved in Europe, it'll save you a huge bill if you go to the hospital. And that's if you can even get into the hospital at all, because as cases of these three, you know, things are rising and more people go to the hospital, they're taking up staff, they're taking up room, they're taking up, you know, much needed resources that can be used for other emergencies like heart attack, like, you know, accidents, even elective surgeries as well, because we might get to a point where they might just start canceling elective surgeries for cancer, for knee replacements, other conditions, because we are so understaffed, we're short staffed, and basically we're undermanned, not only in the healthcare system but in the public health system. And what we talk about is the underfunding and understaffing of healthcare for not just COVID but basically the decade before, because there's many times we talk about we need to have a reserve staff to step in just in case there might be a pandemic. Our systems right now, we don't have the ability to like handle like an overwhelming of the system. We don't have the staff needed, you know, to ensure that burnout doesn't happen. And what happens during COVID? Basically, staff started getting burned out, staff starting to quit, staff were tired of people going out and about ignoring the disease. I'm not just talking about nurses or healthcare practitioners. I'm talking about even to the janitors, like who handle sanitary services, because they handle like a lot of hazardous material in itself whenever they're discarding sheets, whenever they're dealing with illnesses. So it's just an opening call that, you know, if you can get the vaccine, please get the vaccine, as well as talk to your congressman to tell them like, hey, we need more funding in healthcare. But with that being said, that has been Public Health Top 5. If you like what you see today, like, subscribe, turn on post notifications, all that wonderful good stuff. If there's any more news you want me to cover, please DM me at my social medias in the comment section, as well as, you know, comment below, all that wonderful good stuff. And if you want to learn about the reason I decided not to be a doctor, here's that video right there. So like it up, comment, all that wonderful good stuff as well. Stay warm, stay frosty, depending on what part of the country you're in, and peace out.